My name is Dr. Tasleem Nimjee, and I'm an emergency physician at Humber River Hospital and the physician lead for the COVID emergency response here. If healthcare workers are amongst one of the first groups to get the vaccine here in Canada, it means a significant exhale, I would say. It's something that we have all wanted for a long time. So all of us have seen our patients, especially those that are vulnerable, especially the elderly, really suffer when affected by this virus. And we have seen families suffer through this. And so the thought that we could actually have a vaccine that is delivered first to these vulnerable populations to create a bit of a safety net for them that they have not had through this pandemic. We've never had a global community like this with so many people with their expertise all coming together, rallying around the same cause and feeling the urgency to get to that end product. And so I think that that's also something that we have to keep in mind when we ask those questions about how did this happen so quickly? This changes my life significantly, as it does for everybody. I would say when we get to the point where we're past just that sort of first layer in terms of vaccinating those that are in the highest risk group, and we're actually moving out to larger and broader sections of the community, this means that we get back some of our human connectedness that we can have in terms of face-to-face connections with those closest to us. And for me personally, there's no way to really express what the healthcare community has gone through when it comes to really dealing with our own vulnerability when we were facing the vaccine, especially in wave one when we knew less than we do now, and having to go home each day to our families with that sort of in the back of your mind fear of, am I going to make my children sick? Am I going to make my parents or my spouse sick? You can't underestimate how much that weighs on people every day. We will look for leaders amongst us to get vaccinated, to speak about the values of vaccination, to help guide the public. There are others that like to get that information in their hands and really understand what this means to them personally. And for those people, I would say knowledge is power. Go out there and learn as much as you can about the vaccine to help you get ready to pull up your sleeve and get your vaccine for yourself.